Greater Sydney will be locked down for the rest of the month at least as we struggle to contain this outbreak.
Wards sealed off, PPE stations in disarray. This is a situation confronting staff inside Nepean Hospital, where multiple positive cases have been uncovered and staff having to fill gaps for others isolating after being exposed.
Prior to this Delta outbreak, our members were on strike looking for better staffing.
We are really terrified for the safety of our patients.
It's exhausting. Everybody is feeling it.
April has just finished a 12-hour shift.
I'm so dehydrated, you don't have a chance to drink water, you can't be taking your mask on and off. It's a big day, especially the emotional stuff that comes with it.
More than 500 nurses have signed an open letter to the Premier, urging her to meet with them, stating, given the chronic unsafe staffing situation exacerbated by COVID-19, we cannot deliver the care you expect us to provide and the level of critical care our patients rightly deserve.
Aged care has been in crisis for years. It has hit a point now where we're seeing the system on the verge of collapse.
We were treading water before, but we're actually drowning now.
It's the worst I've ever seen it since I've been there, and I've been in that facility for over 34 years.
It's not just about numbers and about budgets. This is about people's lives. We have to do something about this system now.
Anthony Albanese has made his pitch to become Prime Minister, pledging $2.5 billion to fix the ailing aged care sector.
The Labor leader using his budget reply speech to pledge around-the-clock nurses for aged care homes, better food and safer conditions for residents, plus higher pay for workers, saying neglect had been under the Coalition's watch.
We've been waiting for this for 2 decades, fighting for aged care. We've had the Royal Commission, the COVID pandemic. We've got so many people suffering and our staff as well. So thank you so much.
It's so exciting. It's going to be wonderful to go back and tell staff that there is hope for aged care and that we can all be part of the change.
Today, thousands of nurses from across Sydney and the state declared enough is enough.
Premier, we are not coping. We are struggling before this pandemic even hit, and this situation now is so much worse.
Patient safety is bad, skill mix is bad, people are burnt out, we need more staff.
We are nursing patients out in car parks. Is that a world-class health system?
It's time for the Premier to listen. Give us a pay rise that recognises what we have sacrificed and implement ratios.
It's their first statewide strike in more than a decade. Nurses and midwives calling for a pay rise and 1-to-4 staffing ratios on hospital wards.
Yesterday, there was a patient in the emergency department for 100 hours. That's insane.
Hear us loud, Mr. Perrottet. Ratios does not destroy the bottom line, it improves it. Ratios saves lives.
It's not okay to have one nurse in the waiting room with 35 patients. It's not okay to have a 2-to-5 ratio in resus.
This is not good enough. We deserve better. We are isolated. We are unsupported. Our junior staff are scared to come to work. The government is failing us.
The message for the state government was loud and clear.
There's only 2 people in this whole building. We don't have security guards. When someone is spitting at us and biting at us, we have to barricade ourselves in a nurse's station.
We're here to make sure that every hospital, doesn't matter where you work or where you live, is covered and supported by safe staffing.
They only want to hear the good stories. So they want management to say that they're coping, that they're within their budgets, and that there is no crisis.
We are going to keep walking off the job until we are heard and we are safe.
We are not putting up with this anymore. We will fight you to the end.
Nurses and midwives are on the brink of another statewide strike after rejecting the Perrottet government's
pay offer of 3%.
When you've been pushed to the limit, there's a point where you start fighting back.
We have to have change, and the only way around that supports nurses and ultimately our patients and the entire community is to have ratios.